This is A New Angle, a show about cool people doing awesome things in and around Montana. I'm your host, Justin Angle. This show is supported by First Security Bank, Blackfoot Communications, and the University of Montana College of Business. Hey folks, welcome back, and thanks for tuning in. Today, I'm speaking with Theresa Williams, Crisis Intervention Team Program Manager for Missoula. CIT programs bring together law enforcement, mental health professionals and advocates, and other partners to improve community response to mental health crises.
This is the population that I love because I love the challenge. And I think the first step is, again, that perspective. And going back to when we were talking about trauma-informed, my first question is, what happened to them?
Theresa has a deep background in social work and has worked in the behavioral health space for over 20 years. Theresa, thanks for joining me.
Thank you for having me.
Tell us, where did you grow up and what did your parents do?
Oh my goodness. I grew up in a lot of different places. I was born in Houston and moved around kind of up the western seaboard. But for a while, my parents farmed and ranched.
So describe your path into the mental health space.
Graduate of the University of Montana social work program. Cut my teeth in social work by working at our local homeless shelter.
The POV?
The POV.
Yes.
And really opened my eyes to the work, to the field, and really enjoyed it. And just continued to progress from there regarding education and experience, and then graduated with a degree in social work and moved to Portland and pursued my master's there.
Okay.
And just continued, expanding my field of experience.
So that experience at the POV, what about it
kind
of drew you in?
As I reflect on it now, 20 plus years later, I was inexperienced. I didn't have the lens that I have now, which I would say is a trauma-informed lens. And back then, whenever there was a crisis or someone wasn't following the rules, we called 911. So I look back and based on my minimal training and inexperience, I recognize I did a lot of harm.
Yeah, can we maybe press on that a bit? Because I think it would set up your current work and a deeper understanding of that. Like, in what ways did calling 911 or responding in the way that you and your colleagues were at that time causing harm that you weren't necessarily aware of?
You know, I back then it was a zero tolerance for any kind of substance use.
Okay.
And, we had to breathalyze folks. So there was also power struggles.
Sure.
And
that's just a lot of stigma that you're introducing right from the jump.
Yes. And, my job was to be a rule enforcer. And that's very difficult because there's obviously, now looking back, folks are doing their best. They're coping with a tremendous amount of childhood, adulthood trauma and experiences. And that's all they knew. You
mentioned the word or the term trauma-informed a few moments ago. What does that mean? What should we know about it?
I think recognizing that, especially when you're in an environment where people are not getting all their needs addressed and met, that 99.9% of those individuals have experienced some sort of traumatic event or events multiple times, perhaps. And so if we can understand that they've experienced something, then we could also then understand why there might be behavior tied to that. Okay. So instead of what's wrong with you, you would shift to what's happened to you.
Right. And then how does that help us understand what's happening now?
Yes. And slow down and understand what our response might be and bring more compassion.
Well, let's talk about the Crisis Intervention Team. What is a CIT program?
Oh boy, it's huge. There's a lot of misunderstandings around CIT.
Yeah.
We're training a community of folks, whether that's first responders, law enforcement, members of the public, but we're bringing them all together so we can respond differently to people experiencing behavioral health crises. And so the T for team means that it's this, community team of professionals, multidisciplinary professionals that are working together to fill the gaps in our crisis continuum.
Okay, let's try to draw that out a little
Yeah.
bit. I mean, who's on this team? I mean,
Yep.
you're an employee of the Missoula Police Department, right? But this is more than just police officers. This is a
Absolutely.
whole bunch of different types of people, different skills and expertise.
Absolutely. And so, if we go back in time, CIT was founded in Memphis, Tennessee, in the late 80s. Officers responded to a crisis call where an individual was experiencing a mental health crisis, was wielding a knife. The mom had actually called law enforcement to help support their son, and the end result was fatal. The individual ended up getting shot and killed. And what was amazing about Memphis was they brought together advocacy, the university, behavioral health, and law enforcement and said, we need to do something different. And they did do something different. And that's how CIT was born. And similarly to Montana, it was born just by doing what's called a 40-hour CIT basic academy. In Missoula, we've taken it a few steps forward in that now we have a full-fledged program. And so it's now evolved into a full-fledged evidence-based program. And so we follow that very closely and honor and discuss the roots of it, that it ended up with this family member having a bad outcome.
It's probably a fool's errand to think of a typical type of crisis to which you're responding. It's probably why an organization like yours exists, because there's such a whole range of idiosyncratic events. Maybe anchor on that Memphis event.
Yeah.
How could that have been done differently in
Yes.
broad strokes that the listener would
Yes.
understand?
So what is so important that we teach here in Missoula, following the Memphis model, is when you are training a team of professionals and not just law enforcement, because you think about this web, and it all starts with 911. And so that call taker is getting information, and it's a game of telephones. They're trying to get all this information, and so they can quickly dispatch the right response. And so, with the CIT model, there's training for dispatchers. So they're getting that information and they're getting it out. For law enforcement and first responders, we're training them to slow down.
Just think of it from the vantage point of a police officer. I mean, I think that's one thing that the public just doesn't get how hard a job it is generally.
Yep.
As a social worker entering into this culture, did you have misconceptions that were corrected once you got to know these folks doing this type of work and the stressors they're facing on a daily basis?
Yeah, absolutely. And I think what opened my eyes is when I actually participated in the 40-hour basic academy.
Yeah.
And, the academy curriculum is geared toward law enforcement, but in order for it to be successful, it has to be paired with behavioral health, because we want law enforcement to understand the resources and how to navigate the behavioral health system. But then we also want behavioral health to understand the law enforcement perspective. Law enforcement have no idea what situations they're going into. And they are expected to be the safety net for every single call for service. When the system is broken, when there's an argument between neighbors, when conflict resolution and other things just go out the window or not even a thought, who gets called? And we put a lot on them.
Yeah, they don't have a lot of choice.
No.
Right? They don't get to choose which calls to respond to
Nope.
and which to not respond to. The number of ways that this could go very wrong very fast, I don't think is grasped by the average person who hasn't been in that scenario.
You're absolutely right. And I think for the listeners, what I love about CIT is that it really does help folks understand, law enforcement are humans too.
Yeah.
They have families, they have loved ones. They also have, I know a number of law enforcement that have family members that have serious mental illness. And so this is deeply personal to them. And, they're not to blame for the broken mental health system.
Right.
And they're constantly at the table asking for an improved system. And at the end of the day, again, if we don't adequately fund behavioral health services and have, services and support to meet all different kinds of behavioral health needs, the default is going to be law enforcement, whether you're in rural Montana or urban Montana. The only 24/7, 365 resource we have is 988, which is so good, but still there are those in-person responses that are needed, which is 911, which then is usually law enforcement.
So we've been talking a lot about police officers so far in the conversation, but there's a lot of other tools in the kit, and you and your colleagues manage the deployment of those tools. In addition to officers alone, what other types of people and skills are deployed into some of these settings?
So we're always trying to think about prevention and how we can go upstream. And a big piece of that our office provides, one of which is called mental health first aid. So similar to anyone being trained in CPR first aid, it's kind of the equivalent for mental health. And that really teaches people how to identify when someone's in a mental health crisis or substance use crisis, and how do they respond and encourage them to seek professional help.
Sure.
So that's one way. Another, we do a 2-hour course called Navigating Crises in the Workplace, where we do give an understanding of the behavioral health system and how they can also, what can they do as a family to be preventative. So if someone has a loved one that is taking certain medications, has a certain diagnosis, or prefers one hospital over another, we recommend Smart 911 and building out a profile for that. So if 911 is called, that screen pops up for 911 dispatchers and call takers, and they can get that information out to the first responders. So I think it's, again, we're going upstream, and we want to help members of the public, the community, build those skills when it's safe to do so, to be able to handle some of those things that, and not always rely on 911 unless it's absolutely necessary. 988 covers anything mental health related. And they have a really good relationship with our local 911 call center. So if something can't be safely resolved telephonically, then they can stay on the phone, and they can also get on a back line with 911 and dispatch maybe the mobile support team, which is a mobile crisis team in Missoula, or they can correspond with, fire EMS if that's appropriate, or law enforcement.
Okay. And what does this look like in other communities in Montana?
Yeah, various stages.
Okay.
Some have what's called a crisis receiving facility. It's a 24/7, no wrong door kind of psych ER, if you will. If things cannot be resolved through anyone's outpatient provider or with family and friends, a crisis receiving center is a great next line. So Billings has one of those. There's, I think, 4 mobile crisis teams across the state now. Others are kind of forming and figuring it out. So 988 is across the state. We've got 3 call centers, one of which is here. There's a lot of great efforts to kind of build out and improve our crisis response system.
Some of these challenges of unhoused folks, of folks experiencing mental health crises in public, they seem to be most salient in some of the more liberal cities in the country. Do you agree with that framing? And then if so, why do you think that is?
I have a history of specializing in houselessness response before I jumped into crisis intervention team. And it's really about weather, urban centers where there's resources. So I can't say whether it's a liberal or non-liberal issue based on the city. But to me, it's just about, a lot of different dynamics. Like, for example, I remember getting asked years and years ago, are we even helping Montanans in Missoula? And I pulled up the zip code data because it's one of the questions asked when people are experiencing houselessness. What's the zip code of your last permanent address?
Oh, yeah.
And I was able to say, yeah, like we are serving unhoused neighbors. And then you get the other argument of, well, they're not from here. Why should we be helping them? Send them somewhere else. And then I use the whole, well, how about everybody raise your hand right now if you're from Missoula, or from Montana? And, there's not a lot of people in the rooms that actually have roots here.
Yeah.
But then I'll ask, like, what drew you to Missoula? And it's, the mountains or this or that. And I'm like, it's no different for other folks that, might not have a roof over their head, but maybe they do and they want to get there someday. So why judge?
We'll be back to my conversation with Theresa Williams after this short break. A New Angle is proudly presented by First Security Bank, Blackfoot Communications, and the University of Montana College of Business. This show does not happen without these pillars of our community, and I'm so grateful for their support and encouragement. And speaking of support, have you checked out our new website yet? anewanglepodcast.com. There you can support our show directly with a variety of subscription options. Subscribers get access to bonus episodes, additional segments, writings, and other benefits. So check it out at anewanglepodcast.com.
This is Jeff Meese, media technician at the College of Business, and you're listening to A New Angle.
Welcome back to A New Angle. I'm speaking with Missoula Police Department's Theresa Williams about creative ways to improve law enforcement outcomes. So when you think about this constellation of resources that you've built and that you have now available to you and to your colleagues, like what's next on the list? Where do you want to build capacity?
There's still a lot to be done with how we integrate our resources and really streamline them. So, getting more clear about, when you do call 911, how can you help drive who's going to respond? In other communities, for example, 911 call taker will ask, 911, do you need police, fire, medical, or behavioral health?
Right.
Right off the bat, that could help kind of angle in, who might be the response. I think there's just more efforts to bring partners together and kind of figure out how we can streamline that better.
And how has this work been received by the officers?
Yeah.
I would describe that culture, and I would assume that you've moved that culture in a way. Yeah, just describe that journey.
With anything, relationships and trust take time.
Yeah.
It's just going to be incremental. And I think the biggest piece for me coming in was if any time a law enforcement officer is going to call, I'm always going to pick up.
Yeah.
And I want to be consistent because oftentimes what they face in the community is it's 5:00. Doors are shut. No one's answering the phone. Now they don't know how to help the person that's in crisis or needs resources. Or they call and they get told, I cannot confirm nor deny, or, just all those spiels.
Sure.
And so I kind of wanted to shift that and be like, no, call me or my staff. We will always answer. We will always problem solve. We'll always try to dig and find a solution. And it's led us to create these new interventions. We have a biweekly meeting where we bring together partners in the system to discuss folks that have been referred by law enforcement, that are falling through the cracks of the system.
What does that mean, referred by law?
Yeah.
To be referred by law enforcement?
So there are oftentimes folks in our community that are familiar faces to the crisis system.
Yeah.
And law enforcement gets called and they just kind of spin their wheels and, they're not sure how to help that individual. So they will kind of raise the flag and put in a referral, and my team facilitates those meetings, and we have hospital reps, shelter reps, county attorney, and we come up with community level interventions. And it's amazing when a person is brought up, you hear like, oh, well, we're doing this, or hey, like we know them too. And then it's just like, whoa, like when we had no information, now we have all this information and we can deploy that. We can go support that person and kind of shift the responsibility. So law enforcement doesn't have to keep figuring it out. Now we can let the provider world know, hey, this person is falling through the cracks. So we give them closure, because oftentimes our first responders in general never hear the outcome. And this also helps, I think, stave off some of that burnout and that compassion fatigue.
Right.
Is kind of knowing like when there is hope in the system, when something good has happened, someone's getting help, someone has a housing resource, but they just, the system can't find them. So it's really great when we can partner. And I think that's also contributed to the sense of camaraderie that we all have to work through this together.
You mentioned folks that are perhaps familiar faces to those on your team. some of those folks might be falling through the cracks, as you put it. The flip side of that is presumably folks like that are consuming a lot of the public resource. And so how do you kind of, I mean, from one hand, this is a class of folks that were failing. On the other hand, those folks they're consuming a scarce resource. Let's put it that way. So how do you kind of manage that? There's an ethical tension there that I think is really complex. How do you kind of think about that tension?
So I have a smile on my face, and I'm being sensitive, but at the same time, like, this is the population that I love.
Yeah.
Because I love the challenge. And I think the first step is, again, that perspective. And going back to when we were talking about trauma-informed, my first question is, what happened to them? That this is the situation now. And when you can shift that, and even from a systems level and help other providers shift that, it's amazing how the care changes. And again, when we have those stakeholder meetings, we're setting up community level interventions, which also ensures accountability, but also, like, there's extreme barriers in the system. We are trying to also launch a model called critical time intervention, where it helps the providers in the field follow a model so we can support those folks and report out the outcomes. And it's an evidence-based model. And again, it helps us repurpose kind of the limited resources that we have and work in a concerted way. And we also want to bring on what's called a care traffic controller.
That's great.
To help with that as well. So we have a couple of new interventions that are going to come down the pipeline that we hope will make an impact as well.
If there was one misperception in the public that you could correct, what would that be?
As far as a misperception, it might more be this maybe this misunderstanding of fear. It's about that perception change that this is someone's mom, this is someone's sister.
It's a human being.
Yeah. And when it's resulted in them living on the streets and cycling in and out of the ER, I just think, like, we have to look at it from how can we help? What can we do? Versus, make it go away. I don't want to see it. We have to shift that perspective.
If there's an internal misperception, either within law enforcement or your colleagues, or something that you see is like, if we're not thinking about this right, and you had the opportunity to correct that, what would that be?
That is a culture that we have built, and it's in all of our meeting spaces, is that we come in with, an open mind, open heart, and really think outside the box.
Yeah.
And we have to always talk about people's strengths. We always want to talk about people like they are in the room and be very strength-based. And always come from a space of, what if this was my family member? How would I want them to be treated? And I think when we don't see that in our partners, and I'm not just saying with law enforcement, I mean with our entire team of multidisciplinary folks, it's burnout.
Yeah.
That's because they are seeing the system fail over and over and over again, that, they forget to take care of themselves.
Yeah. How do you take care of yourself?
Yeah. Oh man, this weekend I went camping and I had no cell phone service and I was on the river. Like, that's how I rejuvenate myself, is being in nature. But this work is so rewarding in many different ways. And it is about the connections and the relationships, because, the outcomes are slow going.
Yeah.
But I think it's just those incremental changes, and we keep, like, the CIT team is growing and growing. And so we're seeing more and more of that shift in culture. So not just within emergency response, but in the community. And so I think that's going to help us, eradicate stigma and make it okay to get help.
So can we close with a win?
A win.
Can you tell us a story about a scenario where you guys just reflected, like, hey, we nailed that. That's the system working as it should.
Okay. Well, this is one that comes to mind, kind of utilizing, being smart about resources. So we have a student practicum program. We call it the Wellness and Resource Access Project, and it's a way for us to develop social workers. So think back my earlier story of, working at the POV, having no experience. My way to impact change there is to actually bring social work students in and give them the experience. And they take referrals from law enforcement. So just like we said, the familiar face, we want law enforcement to be able to refer that individual to a student to get them help. So just like that, we had a CIT officer refer an individual to one of our students. The student went to meet with this individual in a park. And when we looked them up in our systems that we have in Missoula, they were not on anyone's radar, on the house business radar, anywhere. And the student listened and heard their story. If anyone passing by would be like, this is just someone, the typical stereotype, like they're just, getting the resources for free and all that other stuff that we hear.
Yeah.
And the student listened and learned that they ended up in Missoula because of a back injury in a smaller community. I'm trying to de-identify this person's information.
Yeah. Yep.
But they were, hardworking, had family, but they were life flighted to Missoula.
Okay.
And they lost their job. They lost everything. And here they are in Missoula, a year later, have not been able to get back up on their feet. The student learned that they have a family member that would be willing to help, but because of that individual's shame and embarrassment, because this is a hardworking person, able to take care of themselves, but because of this injury that happened, can't do anything else. And so through some more interactions, the student was able to facilitate a phone call with
the family member. Mm-hmm. Wonderful.
And the family member was so elated to hear from them and immediately said, get on a bus, come live with me. And the student facilitated that through the Salvation Army, was able to get a bus ticket.
Oh, yeah.
And got that person to live with family. And that was over a year. And they just flew under the radar. And that was our law enforcement that identified that and referred him to the student. And so to me, that is kind of filling the gaps, where some things, kind of missed. But the student was able to take the time and really understand, not judge, but really understand what happened.
Yeah, I think that's a great story because it illustrates the complexity and how unique each one of these situations is.
Yeah.
Theresa, it's been great learning about you and your work. Feeling a lot of gratitude for you and your work. So thank you for coming in here and sharing your stories, but also thank you for the work in general.
Yeah, thank you for having me.
Thanks for listening to A New Angle. If you like what we do and want to support us directly, please consider a subscription at anewanglepodcast.com. A New Angle is recorded at Studio 49, a generous gift from UM alums Michelle and Lauren Hansen. Our presenting sponsors are First Security Bank, Blackfoot Communications, and the University of Montana College of Business. Keely Larson is our producer. Maddie Jordan is our production assistant. VTO, Jeff Ament, and John Wicks made our music, and Jeff Meese is our master of all things sound. Thanks a lot, and see you next time.